Hi guys. In this video, I want to talk about why I use adult diapers instead of catheters. So if you're familiar with my videos, then you've probably heard me mention that I have urinary retention. And if you know very much about urinary retention and incontinence, those types of issues, then you would assume, well, why don't you use catheters if you have urinary retention? So, uh, you know, when I say catheter, I'm talking about an intermittent catheter. So there's different types of catheters. There's the kind that stay in your bladder, like a dwelling catheter, and then there's an intermittent catheter. And a lot of people with urinary retention, because their body won't release the urine, they have to use a catheter to drain it. And they just insert the catheter, drain their bladder, and take it back out, which is an option for me. Like, I could do that. I would have to catheterize every couple of hours to drain my bladder. And the main reason why so many people use intermittent catheters when they have urinary retention is because of the cause of their urinary retention. So, I think the majority of people with urinary retention are people that have an enlarged prostate or some other kind of obstruction. Me, I do not have an enlarged prostate and I don't have an obstruction. So if you do have something like that where the pressure can't overcome a blockage due to like an enlarged prostate, then what can happen is your urine can back up and go into your kidneys and cause kidney damage. I don't have an enlarged prostate and I don't have any sort of obstruction. That's not what causes my urinary retention. My urinary retention is caused by a neurogenic bladder. So, just a simplified version, there's these nerve endings, there's these nerves on your bladder that communicate with your brain, so that your brain knows when it's full and will empty it when it gets full, basically. So there's something wrong with that connection between my bladder and my brain. A lot of times that's caused by a spinal cord injury. It's also caused by diabetes, MS, things like that. And I don't have anything like that either. It's really kind of a mystery why it happened, but I developed it right after a growth spurt whenever I was 12. And it could have been some neurological problems that were existing that just got exacerbated by a growth spurt, or it could have been, just completely triggered by the growth spurt. I don't know, the doctors don't know. Either way, my bladder does not communicate very well with my brain. So what happens is it gets full and it kind of gets it builds up a little bit of pressure. And then once it builds up a certain amount of pressure, it just flows out. So long story short, there's no risk to my kidneys because I don't have an obstruction. So for that reason, I don't have to use catheters. So why would I want to use adult diapers instead of catheters? So, well, the first reason is completely obvious. A catheter is very uncomfortable. It is not a fun thing to catheterize. It can be very painful. It can also cause UTIs. It can cause a lot of really, really bad things. You can get a really serious infection. You can even get sepsis from using catheters. And, whenever I developed these issues, um, I was 12 going on 13. So it was, right before my 13th birthday is when I started having issues. And, the doctors, they did a bunch of tests on me. They determined that there was no risk to my kidneys. And so they strongly suggested, that I don't use catheters until I'm older. And so, basically my parents, they put me back into diapers. And, as somebody who was 12, 13, that's something that I could manage by myself. You know what I mean? I didn't need any help. I was old enough where, you know, um, I can figure it out, and I can change my own diapers. It's not a problem. And basically, my parents didn't have to worry about me getting an infection or hurting myself. So, long story short, I started wearing diapers. And, honestly, I got used to wearing diapers. And once I got older, I just decided, I'm just going to stick with wearing diapers. I'm not going to ever switch to catheters because of the risk that's involved, because of how uncomfortable it is. And, diapers work just fine for me. So, hopefully, I can get away with always wearing diapers and not having to catheterize. So, once I get older, I'm in my upper 30s now, so I am getting older. Not the age to where you really have to worry about prostate issues, but say I get an enlarged prostate, that's going to make my urinary retention way, way worse. So if I just get a little bit of an enlarged prostate, then I might have to start using a catheter instead of adult diapers. So I'm hoping that doesn't happen, but basically that's the reason why, even though I have urinary retention, I use adult diapers. So there's no risk to my kidneys because I'm not catheterizing. It works just fine for me. So I hope that answered any questions you might have as to why somebody with urinary retention would use adult diapers instead of catheters. So that's pretty much it for this video. If you like this video, like, comment, subscribe. If you've got a friend or a family member who has urinary retention and they're wondering if, maybe they can avoid catheters, maybe send this video along to them. I do want to stress, if you have an enlarged prostate that's causing your retention, or just any sort of something obstructing your urine flow, causing you to retain urine, then unfortunately you're probably going to have to use catheters. And just FYI, I am not in the medical profession. I am not a doctor. I did not go to medical school. And this is 100% not medical advice. I strongly suggest that you follow the directions of your doctor. And honestly, that's what I did, and that's why I wear adult diapers. So that's pretty much it for this video. Thanks, guys. See you next time.